I grew up overseas actually, initially as a child, and moved back to the States. I'm around 10 years of age. Been in Louisiana most of my life. Lake Charles area is where my parents live, and I went to high school. And then made my way to Baton Rouge for LSU undergrad, and then on to New Orleans, LSU for medical school. And then from there I went to Alabama, Birmingham particularly, to do my residency training. In high school, we had to do a research project on what you want to be when you grow up. So my answer was actually internist, not doctor. So I did some research in that, and going into medical school was my goal from college on. And internal medicine I like because it's primary care, it focuses on adult. A little bit different about myself is that when I was in medical school, I decided I also liked pediatrics. So I wanted to train in both, and I did a specialty, a combined specialty. There's only so many in the country in combined internal medicine and pediatrics. And that's what I did at the University of Alabama-Birmingham. I love Baton Rouge. I enjoyed it here while I was in college, and made a lot of friends here, mostly through my church. And so I wanted to come back here. I also have family here. I had heard that the Baton Rouge Clinic is a great place as far as physician quality, so asked one of the physicians here if they needed an internist, and made my way here, got an interview, and worked out well, so here I am. I love being a physician. I truly do think it's the best job in the world. You get to help people, meet new people every day, which I really like to do that actually. Get to know them, and then get to know them through several years and develop a relationship. I like to be able to be there for them when they have tough things come up in life, and just the day-to-day occurrences, you know, how their family's doing and those sorts of things. So having that continuity and connection with the patient is great. I love my family. I think that's really important, and pretty involved with my church as well. So those things are important. When I get a chance, I go on mission trips. I do medical mission trips. I helped organize them, and my pediatric training is usually most helpful then. I see a lot of kids. So I've been to mostly Latin America since I'm bilingual. Peru, Dominican Republic, Mexico are a few of the places I've been to. I think the Baton Rouge Clinic is very good because of the quality of the physician, the services available to the patient. So much so that I chose it as my own place for care, and my children's care as well. So it provides everything that the patient should need with a personal touch.